During my final semester in paramedicine, I participated in the unit CSB346. In week 6 of this unit, a lecture was given providing students with information on the topic paramedicine as a profession. From the 1st of December 2018, paramedicine will be the 15th health profession to be added to the Australian Health Practitioner Registration Authority Board, also known as AHPRA, and be viewed as an official profession. This is to ensure all paramedics have the appropriate qualification and that there is a national standard for paramedics to practice at and be accountable for. Most importantly, the change to AHPRA is a chance to ensure quality care and patient safety. This presentation uses the 5 R's reflection model to break down and examine paramedicine as a profession. It aims to explore emotions in response to the change to AHPRA, understand the new protocols, and lastly, focuses on how the new protocols affect practitioners and the treatment they provide to the community. I believe that paramedics being added to the AHPRA board is a positive change for both paramedics and patients. I feel that having a standard for all paramedics to uphold is something that will improve the standard of care. I feel that being accountable for our actions could help prevent poor decisions being made due to consequences impacting the individual who makes the poor decision. As with most changes, there will always be some level of apprehension. I have observed during my final placement as a paramedic student many paramedics who have a negative attitude towards the change to paramedics as a profession. I believe that this may be due to the lack of education provided to staff with information on the change and how it will impact on them and their patients. I believe that the only reason that someone who is appropriately informed should fear the change to AHPRA is if they know they are not providing quality care. As an endorsed enrolled nurse, I have been registered with AHPRA for the past 3 years. This personal experience with AHPRA has been nothing but positive for me. Although I have a passion for lifelong learning, I find it helpful to be accountable for my continuous professional development hours. I find it comforting to know that all nurses I interact with on a daily basis meet the necessary requirements to practice. I would like to explore in detail the changes that AHPRA will have on paramedics, as I believe a significant factor in the negative view on the change is due to the lack of education. AHPRA binds paramedics to policies and procedures, such as the Code of Conduct, Social Media Policy, and Mandatory Notifications Guidelines. It is important for paramedics to be familiar with the content of these documents and understand them thoroughly. In Section 2 of the Code of Conduct, it outlines that providing good care is a responsibility of the practicing paramedic. This is my first example of something that we have always strived for as paramedics, but now are accountable for. So, what defines good care? AHPRA states that good care should mean that your patient is your primary concern. Good care should involve a thorough assessment of the patient. This should then be used to formulate a suitable care plan that may involve treatment and education to the patient. Providing good care means that we respect patients' rights to make their own decisions when they are deemed sound of mind. We don't work out of our scope of practice, and we refer the patient to other members of the disciplinary team if required. We communicate effectively with the patient, involving them in their care and evaluate our treatments to ensure that they are effective. This is all content that we are taught initially as students, but that can be lost in practice and over time. Now let's look at some more complex requirements that could involve more personal emotions for paramedics and challenge their ethics and morals. In Section 2.4 of the Code of Conduct, it discusses that we are not to judge patients and change our treatment for them based on our own belief that their previous life decisions have impacted on their health. For example, We can't refuse to treat a drunk driver just because they made the decision to drink and drive. Just like we can't withhold naloxone from a patient who has overdosed on heroin. Most importantly, and one that is commonly seen on road, we cannot withhold pain relief from someone that we personally believe is drug seeking. Section 3.3 of the Code of Conduct states that we must ensure patients are informed of any potential risk associated with treatment that we provide. It was just a few weeks ago that I witnessed an experienced paramedic provide a 36 weeks pregnant woman with methoxyflurane without any mention of the fact it was a Class C medication that could be transferred to the baby in utero and affect the central nervous system of the baby, creating a depressed respiratory system in the newborn. With the introduction of APRA into the paramedic workforce, we will soon be able to use these documents to support us in advocating for our patients and informing other staff if they are not maintaining the standard of care. Section 9 of the Code of Conduct is focused on the responsibility of practitioners' health. As paramedics, we endure emotionally and physically draining 12-hour shifts. It is our own responsibility to manage shift work and maintain a healthy life balance. Section 10.4 of the Code of Conduct outlines that students are the responsibility of the paramedic and it is their duty of care to support them and their learning on road. This means that supervision is required to ensure the student works within their scope of practice. It is also the paramedic's responsibility to treat the student with respect. On placements, we experience a wide range of paramedics, some of whom do not enjoy having students and do not take it upon themselves to give them the opportunity to learn. This standard ensures paramedics understand that it is mandatory and not optional to have students and support them. For paramedics to maintain their registration, they are required to maintain a minimum of 30 hours of continuous professional development, CPD, every year, 8 of which must be interactive with other practitioners. Some examples of activities that count for CPD include accredited courses, conferences, research, presentations, online learning, reflections, reading books, participation in accreditation, employment professional development, performance reviews, or meetings. It is the paramedic's responsibility to keep a record of their CPD for 5 years. Each CPD must be reflected on how it helped the practitioner to improve their practice. As a part of registration, it is also mandatory for each practitioner to have professional indemnity insurance. This is a requirement for all types of employment that a paramedic engages in. The professional indemnity insurance needs to support civil liability cover, retroactive cover, and automatic reinstatement. Paramedics joining the APRA board is a positive move for the future of the profession. This change will have an impact on my practice in the near future, and this reflection has helped me to understand how to integrate the standards into my everyday care. Although I have experience being registered as a nurse with APRA, it is important to understand the individual code of conducts and practice accordingly. It is my responsibility to provide good patient care, be non-discriminatory, ensure my patients are given informed consent, ensure my own health, provide adequate mentorship for students, maintain my CPD, as well as my professional indemnity insurance. By abiding by these principles, I will be able to practice at a high standard and provide excellent patient-centered care.